Along with weight loss, it's one of the many ways to fight osteoarthritis pain. For more information on managing pain, go to fightarthritispain.org.
Welcome to This Week with Sheriff Dave Phelan, a weekly show here on LSN Television. We're also carried by a couple of our radio affiliates right here in Fairfield County. Do appreciate you, the viewers and listeners that join us each and every week, and I'm thankful for the folks here at Fairfield Christian Academy that put this program together, produce it, and certainly honored to be a part of this program. This week's special guest is Toni Ashton, and good to see you, Toni.
Good to see you,
as always.
Too.
And
yes.
This is the first time in a new studio here at Fairfield Christian Academy, so we're breaking things in.
We are.
And Toni, you are part of Prevention Works, and for our viewers and listeners that may not know, what is Prevention Works?
Prevention Works for a Drug-Free Fairfield County is a community coalition. And our mission is to prevent and reduce substance abuse in youth in Fairfield County. Okay.
And how many years, and I know I'm part of that, but how many years has this been in place?
Actually, the coalition was reformed in 2003.
Wow, that's hard to believe.
Right.
10 years.
Right.
My golly.
And I'm actually an employee of Fairfield County Family, Adult, and Children First Council. And the council took over the coalition in 2005.
Okay.
And at that time, we wrote for a drug-free community support grant, a federal grant, to fund the coalition, and we received that grant. And so we have been lucky enough to have the Drug-Free Communities Grant for 5 years. We had a gap year that we did not have any funding from the federal government, and then again received funding in 2010.
So overall, what is kind of the goal of Prevention Works? And then I guess secondly, what are some things that you folks do to kind of make that happen?
Well, our goal is to change the environment. So the coalition, as we try and prevent and reduce substance abuse in youth, we don't do direct service with youth. I don't, as the coalition director, and coalition members, for example, don't go into classrooms and do presentations. We have an agency that does that, the Recovery Center. They provide direct service to youth in schools. The coalition concentrates on environmental strategies. So we are trying to change the environment in our community to reduce and prevent substance abuse.
And I think that, we've talked about this before. I think we have really done a pretty terrific job of letting the community know what's going on.
I think so too. So that's one of the ways that we work, is just to inform community. Anyone can be a part of the coalition. We have teens, we have parents. Through our grant, we have some sectors of the community that are mandated that have to be a part. Law enforcement would be one of those areas. Media, business, schools, faith-based community. So we have some different sectors that have to be represented, but really anybody can be a part of the coalition. We have, since we've been formed, we meet at Fairfield Medical Center. They provide us the space to have our coalition meetings there. One of the things that the coalition has done is to do a youth behavior survey. So every other year, starting in 2004, we have done a youth behavior survey. So we go into the schools throughout Fairfield County and we survey 10th and 12th graders, asking them a variety of questions. When this started in 2004, we started working with all the Fairfield County superintendents. And they were more than willing to have us come in and survey, but they wanted it to be short, so it did not take a lot of classroom time. and they wanted to preview the questions, and so we worked with them initially to form our survey. And at that time, Orman Hall was director of the Fairfield County Atom Board, and he helped us with that process. We did the survey in 2004. We released those results to the community, so we have a big media release. And we have continued to do that survey working with the Fairfield County superintendents in 06, 08, 2010, and our last one was done in the spring of 2012.
And that's pretty unique to anywhere in the United States, wouldn't you think?
It is very unique. When I go to state meetings or even national meetings, we are one of the few counties that we wrote and designed our own survey and have continued to do it through that time period. So it is very unique.
So it's not just guesswork or anything like that. We've got some valid statistical data that lets us know what the kids are doing.
That's correct, and that way we know if the types of activities and strategies that we're doing, if we're working or not, from what kids tell us. So there are not only questions regarding alcohol, substance abuse, but also mental health questions. We have violence questions. We have assets. What are the good things that kids are doing while they're in school? We ask them to list those positive things. We ask them to tell us if they have an adult in their life that they trust at home or at school. So a variety of questions that, like I said, the superintendents clear those questions or vet those questions. And it is a huge process to survey every school, including parochial schools in the county. We have to notify parents that the survey is happening, and so it's a passive permission if parents
Now,
do
do you
not.
take care of that, or does the school?
I take care of that.
You take care of that?
I take care
Oh my
of
God.
that.
Yeah.
So parents can look at the survey. We have those available, and then they can make a decision to have their son or daughter take it or not take it. It's
Now,
up
do
to the
most
parent.
parents, are they agreeable to it?
Most parents are agreeable.
Yeah, because it's anonymous, right?
It is anonymous, and we invite parents to come to the release. Sometimes I'll just have parents call and want to know how the survey results turned out or what we found out. Many agencies and organizations in our county use the results from the survey to write grants, to be able to bring in funding and programs into our community.
Do you find big differences between schools, school districts? Or is it pretty, in other words, if you look at one school district and you look at another, is it kind of the patterns pretty much the same, or do you see kind of some real changes depending on what the school district is?
We only release the data as county-wide data, so we don't compare school districts.
Okay.
We release it county-wide, but what we do compare to is the state of Ohio and the nation. And there are a lot of advantages for doing our own survey. For example, we were able to ask questions around prescription drugs in 2004 before the national surveys even had that on their radar. So taking a locally done survey, we can see what our needs are and add those questions. With the past two surveys, we included questions on synthetic drugs like K2, spice, bath salts. Again, those are not on national or state surveys at this time because it takes them longer to get those questions inserted. So that's one of the positives of doing our own local survey. So I would say with our last survey in 2012, we pretty much have mirrored what's happening nationwide in that substance abuse in youth is decreasing. So that's positive.
And what surprised me is I think sometimes people think all kids are involved in drugs, all kids are involved in all kind of different things, and the reality is most kids are not.
Totally. Most kids do not use substances, and we can show that with our survey results. And I think you're exactly right. One of the strategies the coalition uses is to change our community norms. We want our norms to reflect positives in our kids' lives and our lives. And so through community norms, instead of telling people, you know, that lots of kids are using, so we need to do something, we want to actually state the facts and say most kids aren't using, and that's the norm in our community. So we want to have those youth that might be experimenting or using look at the norm as not using and move them towards that norm.
What's the biggest, if you think back on the first time this was done in 2004, and you look at 2012, anything that's kind of surprised you over the years? As far as, or has there been any major shifts one way or the other between those years?
I would say instead of shifts, what I see constant is alcohol use. So that's the most used substance, always has been since we started, probably always will be. Some of the things that came out of our 2012 survey that was surprising was that marijuana use was higher than tobacco use. And I'm talking about Fairfield County high school seniors.
Okay.
So
that is surprising.
Great that tobacco use is down,
right,
but not so good that the marijuana use is higher than the tobacco use. We did see a trend from 2010 to 2012 that all substances decreased, including marijuana. So it did decrease, but even looking at comparing the tobacco and the marijuana use was higher than tobacco.
And why do you think that is? Why do you think there has been a decrease?
I can only tell you my theory about it. I know that there is a lot of information in the media around marijuana use, around the legalization of recreational marijuana that just happened in Colorado in November, the legalization of medical marijuana in multiple states throughout the United States, that there is a lot of information out there, sometimes not good information, sometimes not factual information regarding marijuana. But I think kids read some of this, and if they think it's legal, recreation-wise, medical-wise, must not be very much wrong with it.
And I think that you know, one of the things that I believe is, and you know, they talk about legalizing marijuana. Well, if something like that would happen, you would open a floodgate of new people that have problems with using. You'd have more problems with drivers that are impaired. You'd have a host of different problems we don't have today, because the reality is that most people obey the law. In other words, if all of a sudden, you know, most people say, I know something's illegal, I'm not going to do it. That's most people. Now, if all of a sudden that product becomes legal, then the next thing you know, you're going to have more people trying it, more people experimenting, and you'll have a whole generational impact that will not be positive, not be good.
Right. When we talked about community norms before,
right,
that's going to change our community norm if it is legalized. And the coalition's stance on medical marijuana is that it should be treated like any other medicine that is approved. It should be approved by the FDA, not by voters. That there is no other medication that we smoke. So that's something that needs to go through a lot of testing before they approve drugs through FDA.
Toni, we're almost out of time. I would like to have you back next week and talk about, maybe we'll talk a little bit more about this. This is a big issue. It's going to be facing maybe even Ohio voters. And secondly, some of the other programs that you've been involved with, Prevention Work's been involved with, because there's a lot of different things that you and the coalition has done over the years. So
Great.
You can come back next week. I'd appreciate it.
That would be great.
And, well, the clock on the wall says we're just about out of time. Do appreciate you, the viewers and listeners that join us each and every week. And if you're out there driving, buckle up, have a good week. God bless, and we'll see you right here next week.
I can't say enough of how this center influenced me and the benefits that my wife got from it. I thought nobody can take care of her like me, and I knew I had to do something for my family. It's in their hearts that they want to provide the care for the people that deserve it here.